Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professional. Today, we're going to continue our discussion with Dr. Wesley Shankland of Lima Dental Associates about dental sedation options. Good morning, Wes.
Good morning, George. Nice to see you again.
Good to see you again.
Thank you.
Now, last week we were talking about some of the reasons why people don't go to the dentist, and fear was a big one, wasn't it?
It sure was. Fear has been a big problem for years. I hate to say this, but 100 years ago or more, we did not have local anesthesia, so people had to have any dental care they had without anesthesia. So that began the problem there. And two, people don't like to go to the dentist to begin with. That's why at Lima Dental Associates, we strive to make it as enjoyable as possible, and we can use sedation. Sedation could be as simple as nitrous oxide and oxygen, which it's called laughing gas, and that's because the way it was discovered back in 1880s, or 1850s. But laughing gas we give you as you breathe it through your nose, so you can drive to the office yourself, be sedated, be very comfortable with procedures being done. Then you can have oxygen before you leave and drive home. Nitrous oxide is excellent. Another way to sedate somebody is with an oral medication. We use a lot of that. Someone takes an oral medication the night before, maybe, or the day, an hour or two before the appointment. They're driven to the office, and they have a very, very comfortable procedure, and sometimes they don't even remember it, George.
That's what they call the non-IV?
That's the non-IV sedation. That's right. And then their IV sedation. Our doctors are very trained with emergency medical skills and very trained in IV sedation. They're board certified. And we use IV sedation on a lot of people. Just before I came here today, a little 5-year-old child was being treated, severely bad problems with the patient, and so they were using nitrous oxide and some oral medication that she drank, and this child went through significant treatment without one peep, without one tear, and this child, just like with IV sedation with adults, this child will not remember a thing.
Right.
So IV sedation is great because most of the time people don't remember anything. They go home, they sleep, they're comfortable. So again, a Lima Dental Associates.
Is that it? It's all over?
That's all over. You know, a lot of people have had minor surgeries like colonoscopies or tests like that. They know what it's like. They have a mild sedative given to them, and after that they go home. They don't think about it. They don't remember it very much. It's rather pleasant. So
how do you know what is the best one?
Well, it depends. We have to do an examination and a consultation to determine which is best for you, go over your medical history, and talk with you and see which is the best and which is most comfortable, most efficacious for you.
It sounds like you're taking a lot of time educating the patients.
We spend a lot of time with our patients, and we talk to them, make sure they know what's going on, they're well informed.
And?
Keep smiling, keep sharing, and keep caring.